Hello, welcome to the Medical Home Portal website. I'm Jennifer Goldman. I'm a pediatrician at the University of Utah and the medical director and editor-in-chief for the Medical Home Portal. I want to welcome you to our website and give you a brief orientation to what you might find here and why it might be of use to you. I want to start by pointing out that the medicalhomeportal.org is the web address, and then if you go to this page you can select from different locations that are partnered with us to include their service directories. We'll get into that a little bit more later, but I'm going to show you here. If you use this drop down menu, you can select a directory from a location that you're in if your state is currently a member. On the home page, you'll see that there's a little orientation to what the Medical Home Portal is. So let me start there. The Medical Home Portal is a online resource, mostly educational resource for professionals and for families who work with children with special health care needs. And so it's set up to really target a couple of different audiences. One is the clinical audience. These are primary care clinicians of children with special health care needs. And the other is families and caregivers and patients of children with special health care needs. So these are our two main audiences. And you'll see that if you look at the top menu, we're divided here: parents and families menu, physicians and professionals menu. There's also a services directory and state partner projects, and we'll get to those towards the end. So let me first take a moment to show you what kind of resources are available for parents, families, caregivers of children with special health care needs. So back up a second just to let you know that the website was created over 20 years ago when the medical home concept of trying to have a children's health care needs addressed in the primary care clinic in conjunction with family, in collaboration with specialists, in coordination with schools and other services in the community, when this was a concept that was really taking wing at the time. And the site initially targeted information about conditions that were pretty rare, hard to find good guidance on, but has since added a lot more information about different conditions, some of them still rare and some of them more common to children with special health care needs. Okay, so we're in the parents and families section. And in this section, there's lots of good information. So if you are a parent and you are have a child or a baby who you're worried may have a diagnosis, but you haven't yet gotten a diagnosis, there's information for you. And there's also information for after you have a diagnosis as you go throughout childhood and transition them into adult care. There's relevant laws, there's terms, there's how to find quality information, there's understanding different healthcare problems, lots of good stuff on family support. And it's helpful to know that the large portion of this material is written by parents of children with special health care needs. So you can see how to take care of your family, lots of stuff in there, how to get funding for their child's special needs, legal issues, and some personal stories and support groups. There's information on meeting your child's needs, information on how to partner with healthcare providers and other caregivers, and then information about transitions that are important during your child's life. These are the kinds of things that if you're a clinician looking at this, you can direct families to here for good quality information that's targeted for their comprehension level and has resources attached to it that could be really useful as well. Okay, I'm going to go back to the home page and show you information for physicians and professionals. Oh, sorry, one more thing under parents and families. There are a whole bunch of frequently asked questions that relate to many of the medical conditions that are referenced in the medical home portal. So if there's information for clinicians on how to care for children with this condition, there is likely going to be a frequently asked question that corresponds to it, and these are written for families. So families can go here directly, or clinicians can point them to this to get good information. They're all set up kind of the same way with some similar questions that families have identified as important, and then maybe some more specific ones and resources. Okay. Under physicians and professionals, there's some information on providing a medical home. This section has a lot of sub-information talking about coding and billing. It talks about care coordination. This is a big section specifically for care coordinators who also make use of the medical home portal. Common issues for children with special health care needs has kind of become a catch-all for different topics, medical topics, where we have guidance on how you can handle this in the primary care setting. Not all of them are common, but it just means that the information is a little bit more concise than what we'll find in our diagnostic modules, which I'll show you in a minute. So I'm going to scroll down this list so you can get a sense of the different topics. And know that these are getting updated and new things are getting added from time to time. So this is a little slice in time. Education in schools gives you some information, kind of the things you might need to know about 504s and IEPs and learning disabilities. Feeding and nutrition has some good information that gets into some topics that a lot of primary care providers have questions about. We have a newer section on guidelines and algorithms. These include care process models that are getting published, and this section is growing pretty quickly right now. A lot of these reflect things that are used at the University of Utah or in Utah throughout the state, but some of them are national as well. Medical technology, and then quite a bit under screening and prevention. And then the transition issues section is still under development. So let me go back and show you some more under physicians and professionals. There are a whole set of diagnoses and conditions, and we call these modules. These are the types of things that if you were to click on one of these, you'll get pretty in-depth information on how to diagnose and manage and treat this in your clinic. We try to update these every 2 to 3 years, and they should have good evidence base for them. There's a menu here you can scroll through. Each of them has a resources section. Some of these are resources for clinicians. And some of them are more for families. And then we get into service providers. So this is kind of interesting. I'm going to show you if we were to select Utah as our location, you can actually search by different kinds of providers for Utah specific. Let me go back down there. So if you wanted to send a patient to neuropsychiatry, you could click on this and get a list of Utah neuropsychiatry, neuropsychology locations, and you can sort it by map, which is pretty cool, I think. And you can develop lists for patients if you want to send them to any of these. So that's what that looks like. Okay. Go back. So those are how the diagnostic modules are set up. And then we will go back up here. Oops, let me just go home. And then show you, there's also a section for what to do if you get a positive newborn screen on many of the conditions that are on different state newborn screens. So there's links to them. Let's say you were looking at MCAD. You can see there's information on screening, testing, clinical characteristics, and what to do with the positive screen. And again, it's going to link you to some information, tools, and relevant service providers that you can search for by partner state as well. Okay, just a couple more sections to be aware of. I'm going to switch over to the Utah directory now just to model this. The services directory is a big part of this, and this is where it really is beneficial for you to register for an account, because if you sign in, you can save different lists of service providers. So I showed you in the ADHD module that you could go to neuropsychology and see a list of providers, but here you can search. So let's say you wanted to look for autism related service providers, and you wanted to do it by zip code. You could narrow it down that way. If you just want to do Utah, you're going to get a few more providers all up and down the state. And then you can click on these to get more information about what they provide and get the link to their website. Some of them have more detailed information. There's a lot of service providers and mental health related categories, behavioral health, that I think is really useful as well. And then you can, if you want, you can start to register and save lists of service providers. And there's another training video on how to do that as well. And finally, state partner projects. These are for the member states who partner with Medical Home Portal. And so, for instance, I'll show you in Rhode Island. They have their PDPRN program that you can learn more about. In Utah, there's the Children's Care Coordination Network, which is primarily for care coordinators, and then the Transition to Adult Healthcare project that's active in the state to improve the practices of transitioning youth patients to adult care. There's also information on the pediatric writing elective and the writing career development group, which is for faculty and fellows, if you are participating in those. So that's a quick overview of what the site has. We are working hard to update material and add new material, and we welcome feedback. If you want to give feedback, suggestions, updates to service providers, you can go to the bottom of any page and do contact to us or directly to feedback. All right, I hope this has been a useful orientation for you, and that the Medical Home Portal helps you serve your patients or take care of your family the best you can, and we are happy to be part of that. Thank you.